We see things online all the time about low back exercises to fix back pain, but what we hear in the clinic is that it just makes it worse. So what we're gonna tackle in this video is 4 exercises that you can start doing today that won't cause you problems in your low back, and it'll get rid of your pain and get rid of it for good. Let's get into the video. First, we have to define the core. So the core is not just the abdomen, it's the hips, the abdomen, and the shoulder blades all working together. So what we want to do with our back, we don't want to get hypermobilities and problems in our back. We want to keep our Superman emblem or Superwoman emblem and our belt buckle stacked over each other. So I want my movement patterns coming through my hips, and I want to stay stacked right here. When I do sports, when I do other activities, I still need to be able to reach out to the side and grab something, but I shouldn't be doing that repetitively, and I shouldn't be stepping over myself, and I shouldn't be initiating my motion coming this way. I should be driving out of my hip. Why do football players in the NFL have the biggest butts ever? Because that's where their power comes from. They're driving from those areas. Great athletes have big butts, so we need to be able to drive through our hips. It's about an 80-20 rule. We need 80% firing coming through our hips, and we need 20% coming from our core, but it needs to be in a way that we're resisting too much motion. Hypermobilities are the reason that people have problems. They have chronic problems long term. Hypermobilities are because we move too much through one certain area. Why do people have so many problems with their L4, L5? The most herniated disc is L4, L5 in the low back. The most herniated disc in the neck is C5, C6, right? So that we have a stable segment, and the first segment that starts moving gets herniated because that's where the movement's coming from. That primarily, I have a hypermobility at C5, C6, it's moving too much, and I have a hypermobility at L4, L5, that's moving too much, and so it causes irritation, bulging disc, arthritis, stenosis. We end up having problems in those areas because we have a stable segment here in the hips, and then the first segment that starts moving, we end up with a hypermobility. We move too much at that area. So the objective with our abdomen, with our hips, with our core, with the core of our body, with our shoulder blades, all of this is to move through the hips and keep this stable. So the abdomen should be resisting motion. So the abdomen, meaning the low back muscles as well, should resist motion. So we want to resist extension and resist rotation. When we do that, let's say I posted a video a while ago about Travis Kelce, one of the NFL football players. He was catching a football, he was running this way, and the ball was thrown behind him, and he turned around and caught it, but then his hips came with him and he twisted over. That's a very athletic movement, and what's happening is his core is engaging and pulling him into that rotation, so he's not doing this and hyperextending into his back. And he might be able to tolerate that, but at age 60, 70 years old, we're not able to tolerate those big motions because we've spent years and years with hypermobilities moving through single segments too much. And so we want to limit that, and that's what we're going to do with these exercises. We don't want to do exercise where we're moving a bunch through the low back and trying to load it up and strengthen it up, because that's just going to irritate the hypermobility more. We want to work on resisted motion in those areas. By working on resisted motion, we're treating the low back as a stabilizer. We don't need it to be our prime mover. We don't want to initiate movement through our low back. Our low back, if I'm doing a squat and coming down, then I don't need to do this to come back up. I need to move through my hips. My hips need to initiate the motion, and then my low back and my abdomen, everything, this is stabilized so that I can have power coming through it. If I have a stable segment and power driving through my hips, then I'm able to move more efficiently, and I limit that motion in the low back, and I limit that degradation over time. With all that being said, we really need to talk about hip hinging. Hip hinging is the most important thing that we do. Keeping my Superman emblem, my belt buckle stacked. I'm driving out and driving out. Now, if I'm bending over, I'm keeping them stacked as well, right? So that's me hip hinging. I'm hinging back at my hips. It's like somebody shoving me right here in my hips. I push back, my chest comes down, my face stays in line with my chest, and then it's like somebody's pushing me up from my butt bones right here. They push me up. I'm hip hinging. I'm moving all through the hips, so this stays stable. Now, to make that stay stable, we have to do some exercises to resist motion in the abdomen, but we got to be firing the hips. So we don't forget that we do that hip hinging. We reinforce that movement pattern consistently. Let's get into the exercises. We have some equipment here. So you might need some equipment for this stuff so that we can load over time, but in the beginning, you're not gonna need much. And you can use things around the house. So I'll give you some ideas, but if you want more videos on things that you can do around the house, just let us know. We can put something together for you. The first exercise we're gonna do is an RDL. So we're gonna work on the hip hinge. An RDL is a Romanian deadlift. And then we're also going to talk about a deadlift. A deadlift is actually a great exercise. My stepdad actually asked me this. He goes, why would anybody do a deadlift? Everybody hurts their back. And I go, well, a really good deadlift with really good form is actually great for your back. And then a bad deadlift is really bad for your back. So it is about the function and the quality of the movement. That's what's really important. So when I do my RDL, I would have weights and I come back like this. And I'm just coming down to here. As soon as my hips stop shifting back, then I come back up. I'm primarily using my hamstrings, but I'm also using my glutes right here. But you can see that my back stays in a neutral position while I do this, and I'm not kicking my head up in the air. My back is a stabilizer right here. So we're not looking to make the back the initiator of movement. We're looking at working on it while we're working on bigger muscle groups at the same time. But we are working our back, so it is really important. I'm gonna grab this dumbbell so I can do a single arm dumbbell, single arm RDL, coming back like this. I'm trying to keep my back as stable as possible. And I'm loading it right here because the lever arm is in front of me. The further I put it out, the more pressure it puts on my back. But I wouldn't suggest that, especially if you're having back pain. I would suggest keeping it under body as close as you can in the beginning, coming back, and then getting it straight down to your toes right here. And that's going to load your back even more. That's progression. When you get out to here, we have some better exercises for that. But that would be the progression. Start it underneath your body right here and then coming back up. Shorten your range of motion in the beginning, right? So we can come here, short range of motion, keeping that back stable. And then I can work on getting back a little bit further with my hips so I come down even more. We have a step that we'll use. So, and this is how we do it with clients. We'll get this step right here. I'll reach back, set it up, and then so I can make progressions just like this, reaching back to the step and coming back up. And I feel this all in my glutes and hamstrings while I do that. And then I can progress down, getting the steps down lower and lower, and then I can get it out towards my toes. And so we want to make those progressions really, it's realistically, progression should happen on a weekly basis, not on a daily basis. We don't want to overload the back. If you're sedentary right now, take it really slow. If you're working out in the gym, you can just take it a little bit quicker, but make sure that you're able to tolerate those things when you're doing it and that you don't have back pain afterward. And you really shouldn't be feeling like your back is all fired up. You should feel like from here all the way down is firing up. If that's happening, then we're doing it the right way. If it's just our back that's fired up, we're just using our back, right? And that makes sense. Exercise number 2, we're going to do a bird dog. We have a specific progression with bird dogs that we do with clients here in the gym. So the first thing with a bird dog is I'm going to get into a tabletop position, all fours right here. And what I'm going to do is now I'm going to start. So this is a bird dog right here. And people switch like this. Now I want to feel like I have a laser pointer in my belly button. I want that laser pointer to stay in the exact same spot, like you drew a circle right here. And we don't sell laser pointers that will point in a circle that attached to the belly button, but it would be a good idea. Terrible idea, actually. So what we're gonna do, we're gonna think about that laser pointer. We're gonna keep our belly button in the same position. And then I'm gonna start, we do a progression, we do our arms first. So I go right here. I'm gonna separate my legs. It makes it easier if I'm separating my arms and legs apart. And then what I'm gonna do is just do my arm, coming up, thumb up, and I come back down. And then I switch and I take my time in that transition because that's where my back is gonna drop down and I'm gonna start moving around. So that transition is where I'm getting the most work, coming down in that transition and stand right in the middle. So we'll do 5 with each arm with that. So that's 10 reps total. We'll do 2 sets of that. And then the next progression a week later, we'll just add the legs. So we'll do the arms first and then we'll do the legs. So when I do the legs, I actually don't come up like this because typically I'm going to compensate with my low back. You can see that I'm using my low back each time I do this. So what we do is we tap. So I'll come right here and I will push my butt back, tap, transition and push my butt back, tap, push my leg back. I can squeeze my butt at the end right there. So this is working our abdomen and our low back. So we're working on both, and you'll feel it when you're doing it. Now, then the next progression would be to do both at the same time. And so same thing, what we do clinically when we do it here, because we don't want our clients to tweak their back, the first thing that we do is we do that tap at the same time. So I'm gonna come here and I'm gonna get my arm up and I'm gonna tap, and I'm trying to maintain stability, and then that slow transition back, and I'm tapping and coming back in. You can tell I'm getting out of breath. It's actually a hard exercise. Regardless of the weight, it's a difficult exercise. And then you can come up. If you have good hip extension, then you can start coming up, where I come here and I squeeze my glute right there. I don't have the best hip extension. I should probably work on that. But I'm reaching back like this. What I don't want to have is this. I don't want to use my back. I'm not trying to move in my back and use those muscles as movers. I'm trying to use them as stabilizers. So we're always thinking about that. We're keeping that core stable right here, and then we're using the muscles around it, and it's stabilizing for us so we can use those power muscles for our movement patterns, and then we can reinforce it consistently over time. Exercise number 3, we're gonna do an RDL with a front raise. So when we do the RDL, we're using our back, but then the front raise, we're actually putting a lot of stress on our back because the fulcrum, the lever arm, is right in front of us, and our back has to maintain extension to stay up. So we're using those muscles, but we're not bending. Let me show you. So I'm coming back like this, shifting back with my hips. I grab this ball. Now I'm coming up with my RDL, and then now I'm coming forward with the ball. Now I'm using my back muscles a ton. So this is a progression, and this is not something that I'd say to do right off. I would do the first two, and I get a progression to doing this. Now I have a long lever arm, and I'm using those back muscles. Coming down. We want to segment it here. Coming up, coming down, back. So doing that, so now I've got 2 segments. I'm doing that RDL, and I can pair it with that front raise, and then that creates that lever arm, and I'm feeling my back now. I'm using my back significantly more with this one, but it's a very safe exercise. It's gonna be really effective for you. Okay, now we're in the gym. We're doing a single arm row. So what I'm gonna do is come right here, and so I can do it at a depth right here, so I get a staggered stance, and I'm pulling back and I'm maintaining. So now I'm not letting my back go into rotation as I'm coming out. So I'm not making it a mover. Now you could do that using your hip like this, and I stay stable, but what I would do in the beginning is we maintain this position, and I'm pulling back to my rib cage. So I'm doing a cable row. I can do the same thing. You can do this with bands at home. You can do it with all kinds of stuff. We just create resistance off of a wall or off of a door, and then I'm coming down like this, and I'm pulling back and maintaining that position so the weight wants to pull me into rotation like this. So I want to resist that weight. I don't want it to pull me this way, and I don't want to have to pull it back. What I'm going to do is just maintain it using that position, and then I can switch sides and do the same thing, and I keep my staggered stance so I can have pressure off of this glute, and that gives me stability for my hips. Now we have a variation. It's a little bonus exercise, but you have to have some equipment to do this. So this is an offset row. So this really challenges you that we come this way. We typically have clients come down to a knee right here, and then they pull back, maintaining one side, and it's a push-pull motion. So they're coming down here and push-pull, and you'll really feel that on this side of the back. We're using those back muscles and the QL and our obliques right there, and so we're firing up all those muscles. So now we've challenged those muscles in really good positions. We're maintaining a good position, and we're challenging ourselves. So we're working our low back, but we're not overworking it because we have hypermobility. We don't want to create problems while we're trying to fix a problem. When we talk to clients about these exercise programs and how we load the body, what we talk about is conceptual adherence. So understanding the concepts and then working within the concepts. And what that leads to is better decision making on your part, right? When you're watching this video, you're trying to put together a program so you can get yourself out of back pain. We have a ton of content on low back pain, how to get out of sciatica, how to load the body, how to loosen it up. We always have a relationship with stability and mobility. We need to figure out what we need. Typically, we need a combination of both. We need to increase mobility at the hips. We need to increase mobility at the thoracic spine. We need to increase stability at both of those places, because if we don't have the stability, we won't keep the mobility. So that conceptual adherence, so staying within the confines of the concept that we're moving too much. We have hypermobilities. We're moving too much at those spots. It's illogical to think that there's not a pattern that's happening if L4, L5 is the most herniated area in the back. If that we have the most problems with L4, L5, even when we have clients that have problems all the way up the chain, the majority of the time, the worst is L4, 5, because it comes from a stable segment, and that's the first segment that starts to move. So we want to limit the motion there, and we want to make that movement more diffuse up the spine. When we redistribute that stress, we get long-term outcomes for our clients. They get better and they build that resilience to injury long-term. So check out our videos on the page about sciatica, about back pain. Get mobile and stay active.